Heather. I was a top 20 finalist on... My name is Heather. I was a top 20 finalist on American Idol in 2006.
To vote for Heather Cox. It's 1-866 Idols.
My experience on American Idol was pretty awesome. After competing, I came home to reality. Whoa. That was a good one! In March of 2010, I began experiencing daily headaches, migraines. My head feels like it's gonna explode. It causes severe nausea, which then leads to the vomiting, which then sets off the non-epileptic seizures. It's hard just to get out of bed. Over the last 4.5 years, I have been hospitalized 18 times. After a year of going to so many different doctors, countless medications, it revealed nothing. It wasn't until the second MRI that I was finally diagnosed with a pineal cystic brain tumor in the center of my brain. Doctors told me my tumor was inoperable. There was nothing they could do.
I feel completely powerless, not being able to help her, and it felt like I was watching her waste away before my eyes.
I decided I wasn't going to take that for an answer. I did the research and came across Dr. Shahinian. He said, Heather, this tumor is the cause of your symptoms, and I'm going to take it out. I'm going to give you your life back. I just am really looking forward to the day that I cannot deal with and live with constant daily pain. The biggest fear that I face right now is my babies growing up without a mom. They need me here.
I just love her so much, and I don't want her to ever die or ever get sick.
Determined to be there for her family, Heather put her trust in school-based surgeon Dr. Shahinian's hands.
Heather has a pineal tumor. We're going to go basically to the epicenter of the human brain. The whole procedure will be done using a high-definition neuroendoscope. This is the patient's left and right cerebellum. We're going to go above the cerebellum, underneath the upper brain. There are some veins over there hanging from above. We have to coagulate it and cut it. All of these have to be taken down first. You see that? Right there. Okay, we got it. We're going to start opening this area, and we're going to see the lesion behind these veins. Calcification means that this has been going on for a long time. You see that bluish thing up there? That's called the vein of Galen, one of the deepest veins. You can't injure that vein. That's called the quadrigeminal plate. That controls your pupils. You can see this mass pulsating. That's our lesion. We're separating it from inside the walls of the third ventricle, which is the ventricle that drains the brain fluid internally. This tumor has herniated inside the third ventricle. I've never seen one of these growths come back. They were like in the deepest recesses of the brain. Okay, here comes the main piece. Now that we have taken the mass out, we're going to start closing. Not a drop of blood, completely clean, nothing else going on. Everything is done. The lesion is out. We have the drainage catheter and the pressure monitoring device. Her pressure, her brain pressure is about 6. Anything below 15 is normal. Hopefully we'll take that out in less than 24 hours.
Everyone, please welcome Heather and her husband Curtis to the show. And
First of all, I could see when we were watching footage of your kids how scared the two of you really were that they would grow up without their mother.
Yes. And when you mention my kids, it's like that's when the waterworks start. I don't know if I'll be able to get through this, but yes, that was really the most scary, painful part was watching them suffer, watching me suffer.
And I look at your husband, who clearly just this whole process has been hard on the whole family.
Yeah.
Been through so much, so hard for you, I'm sure feeling helpless.
Absolutely. You know, it was, I'm the type of person that if I see someone suffering or see something wrong, I want to get in and fix it. And for me, it was very difficult to have to stand by and just feel, so helpless.
But the beauty of this is you persevered.
Yes.
Yes.
And I want to flip the tables here because these two parents are here now, and you had the procedure to remove the tumor. And before I even get into how you're feeling, because I know the kids are the most important thing in your two world,
Yes.
you have some more exciting news
Yes,
for us.
we are very excited to say that we are 5 months pregnant with our fourth child. And our oldest is our son, then we have 2 girls, and this will be another little boy, Micah Daniel. Yeah, so MD, yeah.
Oh, I love
And this child is due on the 1-year anniversary of my brain surgery.
Wow. Is it fair to say, just having you here on stage, it seems to me like you're happy again and that your symptoms have resolved and that you truly did find your answer in the surgery?
Yes, I wasn't living anymore. I was just, trying to survive. And finally, for the first time, here we are 5.5 years later since the first onset of the symptoms. I feel like I'm starting to thrive instead of survive.
And Dr. Shanahan, who performed your surgery, joins us. And Dr. Shanahan, I'm sure you take care of a lot of patients who have heard there's nothing we can do. What made you think, and based on your experience, you know what? We can do something here, Heather. We can get this out.
In Heather's case, this tumor was so deep, literally at the epicenter of the brain, that we had to pioneer a whole new approach by going back here in the back of the head, as the video shows, between the upper brain and the lower brain and the left and right brains, because the endoscope can go places that the human finger cannot go. And Heather is the recipient of this evolution of techniques.
Well, it's truly remarkable what you do.